Hi YouTube, welcome back to my channel. My name is Taina and today we're going to be filming another part to our CNA series. So I'm just going to be telling y'all some pros and cons of being a CNA. If you don't know, a CNA is a nurse assistant. You can work in like a clinic, a nursing home, hospital, any outpatient offices. Like it's so many places you can work, home care, all that. I'm going to be starting with the pros. I answered as many questions and everything under my last video as I could. But if you guys have any other questions, just comment down below and I will get back to you. I'm using this cute notebook from my old boss, which is like so cute. So yes, we're going to be filming pros and cons of being a CNA, and I'm going to be starting with the pros today. Kind of reiterating some things that I said in the last video in the comments. Okay, so the first pro is that it is a prerequisite for like higher education. Like there's some people who become a CNA and they are a CNA, you know, the rest of their life, which is completely fine. You can stop there. I've worked with CNAs who have been CNA for 40 years. I've worked with people who are CNA, you know, in school and all those types of things. So that's a pro of being a CNA, is that it is a prerequisite for higher education. Not like college, but it's more so a prerequisite if you want to be like an ultrasound technician, if you want to go into nursing, like a LPN, RN, ADN, any of those. It's also a way you can get your hours if you want to be a physician assistant. So if you want to be a PA, I want to say, I don't know exactly, but I want to say it's like 8,000 to 10,000 hour work patient care that you need to do. So if you're interested in that, then definitely become a CNA. That certification will be good for 2 years. You would have to renew it every 2 years. And most of the time when you finish CNA school, you will also get your CPR certification, which is good. That's already 2 certifications, and that's required to work in most like medical facilities. You know, I would say that's a pro. So if you are looking to become a CNA or you want to do any of those things that I named, then definitely become one. It's not expensive. I got my certification from a place that I used to work at, and they paid me to get my certification over the summer, and that's what I did. And at the time before I did the course, I didn't want to do nursing. My mom and my grandma are nurses. I'm good. I was thinking about doing ultrasound, but I was already in school to get my Bachelor of Science in Healthcare Management, and I graduated in December. So yeah, that's not really in the cards for me anymore. Like if I ever want to go back, maybe like later in life, and like it's something I'm really thinking about it, of course I'll do it, but it's not something that's been on my mind. I'm gonna take a medical coding certification course soon. So that's kind of what I'm doing now, okay? So the second pro is that there are many schedule options compared to like a normal job, which is this kind of goes for like any job in healthcare, but CNA is kind of like more entry level. So I would say like you can work 12 hours, you can work 8 hours, you can do a 2 to 3 schedule, which is basically like you'll work 2 days, be off 2 days, work 3 days, and then it'll just alternate, which I kind of like that schedule. But then like when it came to like take a weekend off, you would like have to, let me see. So if I wanted to take a weekend off, I basically would have to make up those days. So I would end up working like 5 12s in a row because I wanted to be off for 3 days. Like, I don't know about that. And part-time and full-time options. So for part-time, if you work at a facility that's for 12 hours, usually we'll work like 2 days. And if you work full-time, it's 3 12s. Which of course, it depends on the facility. In the hospital, I know that's how they do it. In a nursing home, maybe a little bit different. But the schedule options are a pro. If you work 12 hours, you're most likely doing like a 7 to 7. 8 hours, it would be 7 to 3, 3 to 11, or 11 to 7. So that's always good. And if you're like a workaholic, you can always work a double, like work 16 hours. Some people do that. Y'all can have that. Those are great options for a schedule. Like there are so many, which it does vary for each facility. Like you'll have some places where like if you work 8 hours, it's like you only have 1 day off and stuff. So every facility is different. I think the hospital will be the most consistent with that. And you also have PRN options where like you may have like a minimum hours you need to work per week or per month, and just to like stay with the company, but you can pick up like as much as you want or whatever they have available. So that's always a great option compared to like a normal job where like you'll have set hours. You may not be able to do overtime. Busy person, this is like good schedule options. Like you don't have to work at 8 to 5, only have your 2 days off, or have to use your PTO to like get things done during the week. My next pro would be exposure to other positions. So for me, my major is health, or I graduated now, y'all. I keep saying that, but my major was healthcare management. And honestly, like before I became a CNA and I started like working in facilities, I didn't know how many positions there was. Like I'm, interacting with like a respiratory therapist, people, who do hospice care, even like clerical work, which is more like what I do. I'm just found out about so many different positions that like I never knew about before, even entry level stuff, or possibly things I would like to do later in life or like further in my career that I learned about. So it's not like a little Google search and you're just like trying to find random things that pay good. Like you're actually interacting with people and you're learning what they do on a day-to-day basis. So that's a pro. Next pro is that you don't have to stand like the entire shift. So if you work 8 hours, your break is going to be a little short. But if you work 12 hours, perfect. And not having like designated breaks. So that kind of goes hand in hand. I work 12 hours, so I'm just gonna like do what I did. So I work 7 p to 7 a. So basically, you're supposed to do a round every 2 hours. Once you learn your patients, you don't have to go in every single room every 2 hours. And this is a nursing home, okay? You don't, not the hospital. That's how that was. So after you like do your rounds and stuff, and like maybe you want to stock up a little bit, or maybe you want to prepare for your next round, but really like you don't have to be doing something all the time when, especially overnight, because they're sleeping. So you can sit down, you can be on your phone, people may be doing their homework, you can read a book. If no call lights are going off and you did your round, like no one's gonna bother you. You can eat, like you're good. Versus a normal job where like if you're at a job where you have to stand most of the time, you're not really supposed to sit down unless you're on your break. Versus like in this, you don't really have to take a certain break time because you'll just have periods of time where you're not having to do anything. And having no like designated break times, I know when I worked at 8 to 5, our lunch would be from 12 to 1 every single day. It didn't really move at all. It's like if you do this kind of work, things may come up during the shift. Like they may give you a certain time to be like, hey, try to take your break at 8:15. Try to take your break around a certain time. If you can do that, great. But 9 times out of 10, you can't, because you will be stopped like on the way, like by patients. They may ask you to do something real quick or anything. So it's really not a thing where you have to take your break at a certain time. Like it may be like a rough estimate, or like try to go like after this person kind of thing, but not like at a certain time. The last one is that it is easy to get a job. Y'all, if you know how this job market is right now, bro, I don't even want to talk about the job market right now. It is so easy to get a job as a CNA. Like if you have your certification and if you have your CPR certification, you're good. Like you can walk in somewhere, even if you fill out an application online, which is so annoying. If you want to work in a nursing home, you're going to have to fill out everything again in paper. So honestly, skip even applying online. I mean, you can and chance it, but 9 times out of 10, when you go in there, they're going to have you write everything out in paper again. Which that is so annoying, and I have had to do that like 3 times, and I don't like that. Like by the end of the interview or whatever you do, they're gonna give you an orientation date. That may be like a week or 2 weeks as your start date, and that's it. You have the job. Versus, I mean, a hospital is way harder. I still have not been able to get on at the hospital, y'all, and it's been a while. Not as a CNA doing other things, but yeah, I would say it's relatively easy to get a job as a CNA. Like they need the help, and like the recruiters, they're responding fast. I forgot to say on here as well as a pro is that you can work agency. So agency is where you can make your own schedule. They give you higher pay. They may not have like benefits like somewhere that you actually work for the company, but they do have higher pay. So I would say like for CNA work now, just where I live in North Carolina, I would say the minimum, uh, I would say the minimum would be maybe like $16. If you make less than that, they are really like lowballing you like very bad. Um, I would say 16, and then like if you don't have your certification and you're doing like PCR or something like that, okay, less, okay, until you get your certification. Um, but on the higher end, without doing agency, I would say maybe 21 an hour. And that is most likely you're working third shift with a shift differential on the weekends. So that would be 20, where the $21 comes in at. Anything higher than that, you're more than likely working agency. So if someone calls out at a facility, they may pay you extra few dollars an hour for that whole entire shift. Just little things like that. So I wouldn't recommend doing agency if you haven't been doing a CNA work for, I would say, 6 months to a year in a skilled nursing facility. If you're a new CNA, I wouldn't recommend trying to do agency, because a lot of times if you're in the nursing home, like people won't help you, even if like it's patients who, you know, are a two-person assist. Like people sometimes just don't want to help you. And if you're not familiar with the facility, you're not familiar with the people, it just makes it so much harder when you just get out of school to try and do agency. Like you might even end up losing your license. So I really wouldn't recommend it. No, that's just a big no-no for me. I'm sure anybody you ask will say the same thing, honestly. Now I'm gonna get started with the cons. So the first con I have is that it is hard on the body. I mean, you can lift someone the proper way so many times, and all the, like, you can do the proper like body mechanics and everything, y'all. It's going to hurt. It's not gonna feel good working 312s. It's just not. It's not gonna feel good. Your feet are going to hurt. Your back is going to hurt. Um, if you are giving people like baths or shower in the shower room, you're gonna get soaked. Like everything is just like hard on the body. You may even get hurt at work. Like you may fall, you may slip, just like how they can slip and fall. It's just hard on the body, y'all. Like you'll deal with certain patients like who always like will keep putting themselves on the floor. You gotta keep picking them up. It's just, it is a lot. It is a lot. It's like, I mean, you can do everything right. You can lift the bed up when you're like cleaning them or turning them, anything. It hurts. I don't know who needs to hear this, but being a healthcare worker hurts. It does not feel good. It don't matter how big you are, how strong you are, it don't feel good. So that is a con. I haven't really worked a job where I did so much with my body. Maybe Amazon, because I worked 10 hours there, and there you do have designated breaks, so you get your 30-minute break and 2 15s. But I wasn't bending down, and I wasn't like lifting people. I was kind of lifting more at the waist level, taking it off the conveyor. So that's like the only thing I can compare it to, but I don't think nothing can compare to it, baby. My feet were on fire so bad. Okay, so the next con is the patient ratios. This is specifically in the nursing home because I haven't worked in the hospital yet. So the patient ratios in a nursing home, y'all. The place that I worked at, the place I worked at the longest, is the main one I'm talking about. They had, I want to say 5 halls, one being a rehab hall. So other than that, each hall had about 20 patients. Y'all, too many patients. And don't let nobody call out, because they're going to try to give you half of somebody else's assignment, or however they try to do it. Y'all, I did not last long at that job once I got a hall to myself, because having that many patients was not it. I mean, the good thing about a nursing home is after you're done with your round, you know, you can chill, you can sit down, especially at night. Like, it's not too much going on unless a light comes on or it's time for your next round, whatever the case may be. But that round, it's gonna take a lot out of you. because you are really giving like individualized care to that many people. It's not like every person is the same. Like you just go in there, you clean them, and no, you go in there. I mean, one person could take a while. I mean, you can try to go fast. Sometimes they want to chat. Sometimes like you will just need to change their whole bed or change their clothes. Um, they may need you to get the nurse for something, like maybe their head is hurting or anything. That's definitely a con versus being at the hospital. I want to say you get 11 to 16 at the hospital. Even that is helpful, having a little bit less, because when I was on the rehab unit, it was a completely different story. Because I mean, you'll have like half the hall is independent. You just go in there, make sure they don't need nothing, make sure they breathing, and you walk out of there. At a nursing home with that many patients, y'all, that's gonna make you want to quit. It don't matter how much you love them patients and none of that. Like, it's hard. It is hard. So you really have to care about what you're doing. Okay, so the next con is exposure to disease and hazards. So this is not like just for CNAs, kind of for like any medical position. Disease is like common. You'll have certain rooms that will have like a sign outside, maybe a certain color and stuff like that with the hazard. So you may have to wear like a certain mask. You may have to wear like a little hazmat suit and stuff like that. Those are also like time consuming to put on, take on and off, and yeah, it is a lot. We may encounter like C. diff. Y'all don't want to smell that. Alzheimer's. I wasn't really like familiar with it, but I did have a patient who had Alzheimer's, and y'all, she scared me so bad because I just went in there to check on her, starting my round, and y'all, she started screaming so bad. And then the person from the last shift, came in there, was like, oh, like kind of explained to me, what's going on. And like, you needed two people to change her, and she would be hitting and all this, y'all. I'm like, oh, this is too much. Like, I just want to do my job, but as a CNA, that's a part of your job. Sensitized to some things because it's just it comes with the job, honestly. So the exposure to those things, I mean, it's good to be educated. Scary at times, but just make sure that you're taking the proper precautions, and just know that like safety is everything. Like, don't skip washing your hands, don't skip asking for help, like none of that, because that is your health at risk at the end of the day. So don't take any risk when it comes to your health. The next con was interacting with family or co-workers. So I would say like this is really why I stopped doing CNA work. I don't know if y'all even knew that, because this is like a whole series I have going on, and y'all don't even know I don't work as a CNA. I haven't in months actually. But I would say interacting with coworkers really sucked so bad. Like your coworkers will make or break your work experience. Especially, there's a hierarchy in facilities. Like, if you're a CNA, everyone else is really going to be telling you what to do because you're working under their license. So they will delegate tasks and things like that. Even like working alongside other CNAs, sometimes it's just hard. Like, people are rude. Healthcare, you're working with a lot of women. Women are like so petty and catty. So just be prepared for that. Like, I'm not that type of person. When I go to work, I just want to do my job. I don't want to be doing a lot of like talking and like over explaining and stuff like that. When you work in healthcare, be prepared to over explain and over communicate and just constantly talking. And that just comes with the territory. So that's a con for me. But if you're prepared for that, definitely do it. I won't say that I'm a good communicator. It's just like people sometimes is like, I don't like attitudes. Like, if it's 7 o'clock in the morning, why are we mad? Why are we mad? You signed up for this shift. Like, it's too much, y'all. I hate pettiness, especially at work. Like, I just want to do my job. So like, my job after doing CNA, I got hired at my internship site from school at a clinic. Completely different experience working with grown adults versus being like a CNA. You work with people all ages, but if you work with people who are actually grown, like, come on, too much. And the other side of that was like interacting with family. So like, if you work in a facility, I'm really talking about nursing homes, y'all, not the hospital, but if you work in a facility, you know the patient more than their family does. Like, you know their needs, you know their wants. You may talk to them more than their family. Their family may come like once a week or never come at all. But the one day that their family comes, it's like, it seems like all that kind of creates friction a little back when family is there, because it's like you're making demands. They kind of act like you don't have any other patience. They may ask you like a lot of questions that just aren't like relevant, and it's like they want to spark a conversation when you have other patients. I don't know, I feel like I'm not explaining this like how I should be. Example, I can say like, if you have a patient who is on hospice, you can't do anything with that patient. Like, if they're dying, you need to wait on hospice. They can't get any medication or things like that from the nurse or the CNA. You have to wait on hospice. Like, you sign the form, you can't intervene medically, and like CPR, medication, things like that. The family will kind of be like urging you to do something, urging you, you know, all this stuff, and there's nothing you can do because they're on hospice. So I hope I explained that like good. I'm not sure if I did, but these were just like the major points that I could remember. I feel like the pros are pretty well, because most of the cons kind of go hand in hand with any job in healthcare, are pretty good. So yeah, if y'all have any questions, just comment down below. Thank you guys so much for all the support on my other CNA videos. Once again, my name is Taina. Make sure you like, comment, and subscribe, and I look forward to seeing y'all in my next video.